Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be showing you a before and after of one of the patients we treated in our office. And this patient had some pretty moderate crowding, so we're going to show you why we chose the treatment plan we did, show her pictures before, and then show what she looked like when she was done. So if you haven't yet, make sure to like and subscribe to the channel, and we'll get started here. So this patient, she came in, you can see she's got some pretty crowded teeth. One thing to note is she had what we call an edge-to-edge bite. So the teeth were sitting right on top of each other, and that had caused a pretty significant chip to her tooth there. You can see she's got that pretty damaged tooth. On this side, she had this canine that was blocked out, and her upper midline had shifted pretty far to the right. So you can see the lower midline's right here, upper midline's here to the right. If you look at her face, you can see it's a little hard to see in her photo, but basically that midline was to the right of the center of her face. So on the bottom, the crowding was not too bad. There was pretty significant crowding. On the upper, she had a crossbite here. This tooth was tucked into the bottom teeth. And so overall, pretty crowded case on the upper. And then she had that significant chip of her tooth as well. So treatment options for moderate crowding, such as this patient, we've got a couple options. One is to expand and procline the teeth. And so whenever you have crowding, those teeth have to go somewhere. So one option is to try to widen out the arches, and you can also move the front teeth forward. And so looking at her case, we felt like on the lower especially, she definitely had room where we could probably expand and widen those teeth and bring them forward. You always have to look at the teeth. They have to sit within the jawbone. So you have to look at the bones and can you expand and widen out those arches and move the front teeth forward enough and still fit that teeth. You don't want to move them too far forward because you can actually move them out of the bone, which will cause some gum recession and some other bad stuff. So we were looking at her, we felt like we probably could fit those in. The other option we have is to do what's called interproximal reduction, or IPR. And that is basically to make some extra space by polishing the sides of the teeth. And you make little bits of space, so about a 0.5 millimeter per tooth. And then that kind of adds up to where you can get some more space to get all the teeth in. So this is what IPR looks like. There's a few different methods to do it. So one is by using this disc. You basically go in between the teeth. It'll make a little tiny space. This isn't too bad. It's not too painful. And that little bit of space, like I said, will add up. You'll put it in each individual contact. And you can get a significant amount of space by doing IPR in between the teeth. And the other option is to do extractions, where if we don't feel like we have enough space where we can't get those teeth to fit inside the mouth, or we feel like the teeth are going to stick too far forward and not look good, then we might consider extractions. Here is an example of extractions in this animation. So someone that has totally blocked out canines such as this, where there's really no room to get those in, that's definitely an indication where we might have some bicuspids taken out, and that gives us a space where we can get all the teeth to fit in. So obviously, orthodontists, we like teeth. And it's our preference when possible, we don't want to have teeth extracted, but sometimes that is the best option where we feel like there's no good way to treat it without taking teeth out. And so for this patient, looking at her teeth, we felt like if we were to expand and procline her teeth, that her face would probably still look pretty good. Her lips weren't too far forward, so whenever you bring the teeth forward, it does tend to push the lips farther forward. So sometimes that won't look good aesthetically. We felt like with her, it wouldn't look bad. Also, we felt like there was some room where we could expand, and we definitely were going to IPR in this case as well. So we decided we would first start off by treating it non-extraction and getting all the teeth lined up and then see how they look. And if we felt like the teeth were sticking too far forward, we could always make the decision to take some teeth out after that point. So additionally, because her midline was so far off, we wanted to get things aligned first and push all of those top teeth back onto the center before we made the decision to have teeth taken out or not. So again, this is where we started. You can see the midline was off, the tooth was chipped, pretty significant crowding, but we were going to try to do it non-extraction initially and make that decision later on if teeth need to get taken out or not. So again, here is an overview of all of her teeth, and then we'll go ahead and jump into her final photos. So you can see from the final pictures, we were able to get her midlines on. We went ahead and did this filling to correct that chip on her tooth. And as you can see, we definitely had to procline her teeth. Her teeth are definitely sticking forward a little bit now, more than they were. We also expanded the arches. They're a little bit wider. And we also did some IPR as well, where we polished between the teeth to get some extra space. We didn't end up extracting in this patient. We felt like this was a good cosmetic result. We were happy with it. The patient was very happy with it. we decided we could do it without extractions. So here's a before and after. You can see kind of how things changed. In her before pictures, you can see the teeth were a little bit tipped back, so that allowed us that we could bring them forward and tip them forward, and it still looked really good. You can see it gave her a nice wide smile where we can see more of her teeth. You can see how much the midlines were able to shift back into position. You can see the chip tooth that was repaired. This was the filling right there. And then you can see, like I mentioned, anytime you have this kind of crowding, if you're going to fit all those teeth into the arches, they will be tipped farther forward. And you can see that's definitely the case. In her case, we felt like that was a good result and we were okay with that. Here is her from the side. As we mentioned before, we felt like her lips were not very protrusive, and so we didn't mind if they came forward. And the final photo, I definitely like this profile better. It gave her a little bit fuller lip, and that was an improvement. Again, every patient's a little different, so these are the things we take into account. If someone already has very protrusive lips, that's an indication we may need to lean towards extractions because that might make her profile worse. In her case, I felt like it was an improvement by treating this non-extraction. And so that is the case. So if you have any questions on treatment of crowding, you can ask them in the comment section below. We'll do our best to answer. If you have any comments about this case, definitely let us know. And again, if you haven't yet, make sure to like and subscribe to the channel, and we'll talk to you soon. Thanks so much. Bye-bye.